County Sheriff's Office, and I'm going to explain to you this is how it's going to go. First off, we're going to have the elected sheriff of Cobb County, Sheriff Neil, N-E-I-L Warren, W-A-R-R-E-N. Sheriff Neil Warren will be speaking first, followed by Dr. Brenda Fitzgerald. Dr. Brenda Fitzgerald, who is the Commissioner of the Georgia Department of Public Health and the State Health Officer. So Dr. Brenda Fitzgerald, Commissioner of the Georgia Department of Public Health, and the State Health Officer will follow Sheriff Warren. And then you will have Dr. James O'Neal, O''N-E-A-L, who is the Director of Health Protection for the state of Georgia. Again, Dr. James O'Neal will be third, and he is the Director of Health Protection for the state of Georgia. Ryan Deal is also here. He is the PIO for the Department of Public Health. Ryan Deal is also here to help y'all along afterwards. But we're going to call on Sheriff Neil Warren first. Sheriff Neil Warren.
Thank you, Chief Beck. Good afternoon. You folks probably got about as much a boring life as I do to be here on Friday afternoon. But we appreciate you being here and listening to this press conference. I'm going to talk about the incident involving an inmate that was brought into our custody this morning about 3 a.m. He was charged with DUI and traffic charges. During the medical screening, it was determined that the inmate had flu-like symptoms. The inmate advised a staff member here that he had recently traveled to Africa, at which time we did our medical protocol, and which immediately we implemented that protocol and isolated the individual and arranged for treatment. We notified immediate implemented, and the inmate was isolated and arranged for treatment. And we notified the Cobb Douglas Public Health, and their staff arrived shortly after. The inmate was transferred to our local hospital for further testing and evaluation. The hospital, which was Kennestone Wellstar. Based on our procedures, we sanitized the area, but also based on the health department's recommendation and CDC, we sanitized it a second time. As the sheriff of Cobb County, it's my responsibility to ensure the safety of our inmates, the public, and our staff. I'm very proud of the way my staff conducted themselves this morning when this was brought to our attention. Also, I'm very proud of the Wellstar medical personnel and proud of the health department for assisting us to seek this, to bring this situation to a close. Again, I think that based on what we have done in preparing for situations such as this, I'm glad that we had plans. I'm glad that we had procedures, and everything came together. At this time, I'm going to turn the mic back over to Chief Beck, and so we can hear from the medical folks. And at that time after that, if you have any questions, I'll be glad to try to answer them or discuss them with you. Thank you.
Thank you, Sheriff. Next will be Dr. Brenda Fitzgerald, Commissioner of the Georgia Department of Public Health and our State Health Officer.
Good afternoon. When public health first started ramping up the communications about Ebola back in early August, I quite frankly hoped that I would never be in a meeting such as this. But of course, today we had an opportunity to see exactly how our protocols are working. And I want to tell you that they worked perfectly. I want to thank Sheriff Warren and his staff. They followed protocol perfectly. I want to thank you, the intake nurse, Brandy Shirley, who recognized right away that a history of flu-like symptoms and travel to Africa might indicate Ebola. I want to thank the epidemiologist who immediately came from the Cobb Douglas Public Health, and that is Rachel Franklin and Pam Blackwell. And I want to thank the ambulance drivers and from Metro Atlanta who handled this perfectly. Also, Kennestone Hospital. I can tell you that from the very beginning, from the first moment, this case was handled in absolutely perfect manner. This man was isolated immediately. He was never exposed to other people. He was isolated in the ambulance. He is isolated at the hospital, and he remains under isolation now. I am also happy to report that so far absolutely all of his lab work is negative and normal. We have no reason to believe that he has Ebola. He indeed did have nausea and vomiting, but again, all lab tests, for example, the white count, is absolutely normal. There is one remaining test, which is the definitive test for Ebola, that takes about 6 to 9 hours to complete. We do not have that yet, but at this point, we have absolutely no reason to believe that this patient has Ebola. But we do know, we do have absolute reason to believe that the protocols that have been put in place in Georgia are functioning well. And now, Dr. O'Neill.
Dr. James O'Neill, who is the Director of Health Protection for the state of Georgia.
Thank you very much. I would reiterate what the sheriff had said at the beginning, and that's an extreme sense of pride for the way that all the folks that came together to have this response performed today. I think that you should be very pleased to know that in Cobb County, we've seen some of the best partnerships that have ever been formed by all the different entities that need to be involved in order to have a good response. This really goes back many years. Public health, after 9/11, began ramping up with emergency preparedness efforts across the state. But in my opinion, no district has done it better than Cobb Douglas. The formation of those partnerships here has been absolutely astounding. And it's because of that that the response went as well as it did today. So I think the people in Cobb have a great deal to be proud of. Certainly all the entities that were mentioned are part of this. They form a team. We know that public health alone can't do all that needs to be done in emergency preparedness endeavors. We know that it takes more than a village, more than a town, more than a district, more than a state. It takes all of us working together. And those partnerships of working together are just superb here. Certainly the sheriff and his department are a key part of that, as well as the hospital community here. Wellstar has been tremendous in their efforts to be part of this partnership. I also think that the Metro ambulance system needs to be commended as well, one of the best in the state. And although Dr. Fitzgerald mentioned ambulance drivers, I want you to understand these are professionals. These are EMS professionals, paramedics, who are part of this team. More than just driving the ambulance, they know health care. They know it in the pre-hospital setting. And they certainly did everything that they needed to do on the pre-hospital side to be prepared to deal with a potential Ebola case. We are very, very comfortable at this point that all of the protocols have been followed to a T. We don't expect that the final test is going to be positive, but even if it were to be positive, I think we feel good that everything has been done appropriately to this point. And again, I want to compliment the folks of Cobb that have been part of this partnership that allowed that to happen. Thank you.
Could you remain up here, Sheriff and Dr. Fitzgerald? I guess we can just stand here because we'll open the floor for questions.
Dr. Fitzgerald, could you tell us how these tests were done? It's my understanding protocol usually has a blood sample submitted to the CDC for tests that take 3 to 4 hours. Were these samples submitted to the CDC?
The final test was submitted to the CDC. That is the test for Ebola itself. The other routine labs were done in the state lab, I believe, or Kennestone lab, I'm sorry, in the Kennestone lab.
So the CDC testing is yet to be complete?
That's right. That's a test that takes about 6 to 9 hours.
When do you expect to have that?
In 6 to 9 hours from now. So between 9 and 12 tonight, probably.
Can you explain the difference between those two tests, Doctor?
Certainly. The tests that were done in the Kennestone lab had to do with white count. For example, if a white count is elevated, that might indicate that the person had an infection. His was absolutely normal. We looked at platelet count. Ebola is hemorrhagic fever. It means that you have a bleeding problem. If that's going on, you will have some abnormalities in your platelet count. They were absolutely normal. We looked at some other routine tests would indicate liver involvement and that sort of thing. Absolutely normal. So again, we do not feel that this patient has Ebola. The test that is absolutely definitive for Ebola is a lab test that identifies the virus itself, and that takes a little longer to complete and is being done as we speak.
Do we have any indication whether this inmate actually went to Africa, or was it just a story to himself?
I don't know the answer to that. That certainly was what the information that we were given.
Sheriff, do you have any other knowledge of that?
I don't have any personal knowledge at this time, but that is something we're looking into. But the key word was, he said he had been out of the country in Africa. So that brought that part of our
Do we know where in Africa he was? Was he in Western Africa?
Not at all. I do not know.
I can tell you that the story was that he was in Liberia. At that point, he was in Liberia. He actually had been to the Congo before.
No, actually, he started his visit to Kenya.
Kenya, I'm sorry.
To Nairobi, and from there he came down to Nigeria, but was only in Nigeria for a day. And as you probably know, Nigeria was one of the areas that had an outbreak of Ebola. But the good news is that now been, I think, 44 straight days in Nigeria with no new Ebola cases. So the likelihood of any exposure there was very, very minimal. He was there for a day, and then on his way back, he transitioned down to Monrovia, the capital of Liberia.
And that is an at-risk country.
And that's where the bulk of the cases are now occurring. But he never actually was off of the property of the airport. He did go out of the main building of the airport, apparently for a smoke break, for 10 or 15 minutes. But the rest of the time he was in the airport. That was roughly a total of 3 hours before he boarded his flight for the Washington area.
But that's what he's saying, that has not been independently verified.
That's correct.
Sheriff, you said that you sanitized the jail twice. How long have we placed that on lockdown?
I don't think it was no longer than an hour and a half.
Is he a
of
U.S.
lockdown.
citizen?
I'm sorry?
Is he a U.S. citizen as inmate?
Yes, I'm assuming he is. Yes, I don't know.
Can you tell us anything else about him, his age or anything else besides?
Later on, at the end of this, we will be glad to provide you with a booking sheet with that information.
Dr. Fitzgerald, this case, because Ebola is such a hot button, but have you ever done this before? I mean, not necessarily with Ebola, but any other infectious diseases? Have you ever had to do something like you did today?
Oh, absolutely. I mean, that's what public health's primary core mission is. We, for example, if somebody is exposed to tuberculosis, we investigate that, we track down their contacts, we make sure that they get into therapy. That is basic core public health. And I want to go back to this discussion here about Nigeria. The important thing, there were a couple of cases there in Nigeria, but there have been no cases there for 44 days now. What's important about that is when you compare the medical system and the public health system there to those other countries where the disease is so out of control, Nigeria is way ahead as far as the sophistication of their medical department. And again, in the United States, we have the routine testing of infectious disease done by public health. We have the routine isolation of infectious disease by our hospitals. We have the routine tracking of these kind of diseases done in our medical communities on a day-to-day basis.
It's interesting that you're holding this press conference now versus hours later when you had definitive result. Is that because you wanted to tamp down any kind of public anxiety, or?
Well, again, our medical opinion is this man does not have Ebola. This one test requires longer. There was, of course, concern, and we wanted people to know that, and again, let me repeat, we will keep him in isolation till we have this final test, but we do not believe he has Ebola.
Do you have any idea what he does have?
He had nausea and vomiting.
Dr. Michelle, with Atlanta and Georgia being home to an international airport so big, what is the state keeping an eye on or taking action to do to keep us safe from people coming in with Ebola?
Right. There are three main points to be made. One is medical awareness. The second is public awareness. And the third is, again, this awareness of the sophistication of our medical system and our public health system. In medical awareness, we have sent out letters to doctors. For example, the EMTs, the primary responders, we've given laminated cards with exactly what to do. If, for example, they have to intubate a patient, here's the mask you wear. If you think somebody has Ebola, here's how you clean your ambulance. Very step-by-step, precise instructions. To the hospitals, we have a checklist. We've sent out from the American Hospital Association a checklist on what to do day after day after day. We have sent out, they're called tabletops. Actually, the state of Tennessee has done a particularly good job in designing an exercise series for hospitals. We have sent those out to our hospitals. So that medical awareness is enormously important. The second thing, though, is the public awareness, and I want people to hear this. The way this virus is transmitted is with fluid. That if you have nausea and vomiting or diarrhea, there's fluid. The main way that we get infections is if somehow that fluid comes in contact with a healthy person's hand and you touch your eye, your nose, or your mouth, the virus is transmitted. What that means is if you're in a situation and you're in a public situation, that frequent hand washing, that's a protection here. If you're in a situation where you want to make sure that you're safe, your family's safe, you want to make sure you have that frequent hand washing. So that's basic public health kind of information.
Sheriff, can you tell us, once this inmate notified deputies that he was feeling sick, walk us through the isolation process?
Well, actually, once each time an individual is booked into our facility, that individual is screened, not only booked in by a deputy, but also is screened by a medical member, a staff from Wellstar, who we partnership with for our medical issues. And once those questions, and they screen him about his illness and where he was from, that's what set this off.
Is that a new protocol since the...
No, that's always been in. Yes.
And whether you travel somewhere?
I'm sorry? Yes, yes.
So he was never actually in a cell?
Never in a cell, no.
Where was he taken when he was...
When Metro ambulance service transported him to Keystone Hospital.
I'm sorry, where was he placed in isolation?
I'm not sure about that, but we have a infirmary, but I don't think he was ever taken to the infirmary. Is that correct? I think we held him right there, locked down the book-in section, and went from there, transported him out.
Anything with his family?
I have not had any contact with his, excuse me, with his family, and I'm not aware of our staff having any contact with his family.
What about the person that did the medical screening? Were they also isolated, or what happened to them?
That's a medical, one of the nurses that we talked about, that the doctor talked about, and I'll let, I'm pretty good about the security issues here, but I'm going to let the medical experts talk about that. I'm sorry, Doc.
Excuse me, I'm so sorry. All medical personnel observed absolutely correct medical procedure. That means you have gloves, you have a face mask, and again, we have sent this information out to the medical community, so we know what sort of protection that you need to have on if you are talking to someone that is possibly at risk for Ebola, or if you're treating someone. Again, though, that was completely done from the very first second.
And again, they were never given that final definitive Ebola test because he immediately tested negative for the preliminary test?
He's having the final Ebola test, yes.
Are you testing anyone else?
Oh, there's absolutely no reason to test anyone else at this point.
How many tests did each undergo?
Oh,
Approximately 10.
Did you guys notify the CDC, or is that part of your protocol?
absolutely. Absolutely.
There seems to be some confusion about how you get Ebola, and we've heard that, you know, it has to be direct contact, but we've also heard that it can be through droplets in a sneeze or a cough. So it doesn't have to be touching. It can be if you're standing right next to that person and they sneeze, you can, and it lands or whatever on a membrane or.
It's fluid. The virus is in the fluid, and by fluids, I mean, you know, mucus, vomiting, diarrhea, body fluids. And if you touch those fluids, then you can get the virus if you then put it in a susceptible part in your body, eyes, nose, mouth. But again, this is by fluid transmission. This is not airborne. It's not
You can get it from a sneeze if you're close enough.
if the fluid, yes, if the fluid is transmitted. This is not a mosquito-borne disease. This is, you know, this again is absolute fluid, which means that the protections you need are very well understood. Now, if somebody's really sick with Ebola, there will certainly be a lot of fluids involved. So that's why, you know, when you're dealing with somebody that is really sick with Ebola, you want to make sure that you have complete protection. And that's what you've been seeing on the media.
So he's taken to the hospital.
Yes.
Can you talk about what the hospital's protocol for isolation was?
It was standard protocol that all hospitals abide by, universal precautions. And in this instance, for the Ebola, we recommend really 3 levels of protection. One is standard, the other is droplet, and the other is contact. Those are standard defined precautions that hospital personnel are all familiar with.
Were they put in a room that was pressurized in a
No.
way or anything?
No.
No, the pressurization is for the 4th level, which is airborne, and this is
not airborne.
Thank
Dr. Fitzgerald, you had talked about the exchange of
Last question.
blood, and yesterday we had a news conference with the CDC. We had a teleconference, and Dr. Free finally, you know, came out and said that direct contact is within 3 or 4 feet. So if we have somebody that flies from New York to Texas, like the gentleman in Dallas did, fly into Atlanta, under these same circumstances, he didn't appear sick when he got here. But we have him in contact with nearly 100 people or more when he got here, and you have sneezing and coughing and sweating and evaporation. How dangerous are these people when they're around you if for a long time they've said direct, but now direct is 3 or 4 feet away?
Again, this gets back to what I was saying before. I wasn't trying to be too simplistic when I say wash your hands, because if, you know, it's... The reality is, even if you're around somebody, contact with their body fluid, the most likely thing to come in contact with somebody else's body fluid is your hands. So if you wash your hands, you remove it from your hands, and it's never an issue. The only problem, and the reason for 3 and 4, it's not that 3 or 4 feet away it jumps from that person, you know, 3 or 4 feet. It actually is the fluid comes in contact with someone's hand, in the most common kind. And then you touch eyes, nose, mouth, which is how the virus is transmitted to a healthy individual.
He never went through Hartsfield, right? He never went through Hartsfield in his travels,
I believe
I
he
don't-
did.
I don't know the answer to
When he
that.
came down from the DC area to Atlanta, but we've not actually seen any data to verify.
I don't know that answer to
But
that.
once again, back to your question, I think something that's terribly important that Dr. Frieden has tried to emphasize over and over again is that individuals, let's say on a plane, who get on the plane and don't have symptoms of Ebola, even if they have coughing or sneezing, but they don't have fever, they don't have the GI problems, they don't have the muscle aches and pains, and they don't have the severe headache, they don't transmit the disease.
No.
Even if they're coughing or sneezing, the virus doesn't show up in those coughs or sneezes until they develop the symptom complex of Ebola. The patient in Texas, I understand, didn't develop that until several days after he arrived. So that's why the CDC is not worried so much about any contact that he had on the flight over, because at that time, there's no indication that he was contagious.
But here in Atlanta,
We gotta wrap this up,
we
Doc.
have people in,
Doc. We need to wrap.
Last question,
Yeah.
then we're gonna go. This is it.
Okay, go ahead, I'm sorry. He's my boss. so.
how long can you be a carrier before you start showing these things?
You
and
can't.
able to transmit?
A carrier indicates that you can give it to somebody else. You cannot. The nature of this disease is only when you're symptomatic are you able to transmit the disease. That's the disease process. So when we ask the questions on how do we choose somebody to put into this protocol, the first one is if you've traveled to West Africa and you have a fever, that's number one. Or number two, if you have had that close personal contact with somebody with Ebola, then at that point we put that person in isolation also.
Thank y'all.
Thank you very much.
If you want to see Ryan Neal, CIO, Department of Public Health, or when we get more information, we'll go.